Good day to you all. So today I'm going to be talking about antenatal and prenatal care. Let's start with antenatal. Okay, so what tests should we be doing to confirm pregnancy and calculate the gestational age? So let's start with calculating the gestational age. To calculate your gestational date or your due date there's a formula that says take the last menstrual period of the mom, if she remembers correctly, subtract 3 months and add 7 days, or you can add 9 months and 7 days, which is 280 days. Another way to calculate your gestational age is through an ultrasound. Okay, now let's go to how do you confirm that you're pregnant. There's two ways. First of all, what everyone can get from the supermarket is the urine test, which is a qualitative test which just tells you if you're pregnant or if you're not, and there could be some errors. So to confirm, you go to the clinic, they check they take your blood and they check for your serum HCG level. If your HCG level is 2000, okay, minimum. If your HCG level is 2000, the doctor will do a transvaginal ultrasound and you should be able to see a gestational sac in the uterus if your HCG level is 2000. If not, they don't see with the transvaginal, it could be an ectopic pregnancy. If your HCG level is 6000, you should be able to see something using a transabdominal, not even a transvaginal ultrasound. Okay, now the first trimester, how do they calculate gestational age using the ultrasound? They use it by checking the distance from the crown to the rump of the kid. Okay, so there's this rule that says you can do it with the last menstrual period, or you can do it through the ultrasound. So if you get a mom that says her last menstrual period is 2 weeks and 4 days, and the ultrasound says 2 weeks and 7 days, you can follow the last menstrual period, because there's a rule that says in the first trimester, the ultrasound and the last menstrual period can be off, like different from each other, by 1 week. If the last menstrual period says 2 weeks and the ultrasound says 5 weeks, you have to follow the ultrasound gestational period because that is more accurate. In the second trimester, the last menstrual period and the ultrasound are off by 2 weeks. Third trimester, they can be off by 3 weeks. Why does the difference of the gestational of the ultrasound and the last menstrual period increases with the more trimesters? Is in the first trimester, there's only one factor that's taken into account or that affects the gestational age. It is the date of conception. Okay? In the second trimester, there's other maternal or fetal factors that are taken into account. And they're usually calculated. You can also calculate the gestational age using the abdominal circumference of the mom, the distance between the two parietal bone of the fetus. Okay? So just know in the first trimester, the LMP can be off by 1 week. Second trimester by 2 weeks from the last menstrual period, and third week is by 3 weeks. Okay, let's continue. Initial prenatal routine screenings. So, the first thing we should do if she confirms that she's pregnant, the first screening test is her blood. We should check if the mom is having a blood group of O, or if she is Rh negative. And the fetus, we're not sure if the fetus is Rh positive or Rh negative, but just to be safe, we usually give moms that are Rh negative a RhoGAM at the 28th week that binds to the antigens that the moms might have produced, so that because the mom, if the kid is an Rh positive and the mom is Rh negative, for this pregnancy, she will produce antibodies against the Rh positive. And her next pregnancy or her next fetus, those antibodies might attack the fetus. That is really bad. So that we give her a RhoGAM at 28 week. Another test which we do is we do a pap smear. If the mom did not have a pap smear for the past 2 years and is over the age of 21 years old, we should do a pap smear and we should culture for gonorrhea and chlamydia, as we know they are very common, STDs, right? And we should do a VDRL or an RPR. This is a test for syphilis. So this test detects antibodies that our body has secreted against syphilis protein. Okay, we should also test for hepatitis B. We should also test for HIV if the mom lived in an area with a high prevalence of HIV, or if the mom has multiple sexual partners. And we should also test for rubella. Rubella is like, as we know, everyone when you're born, you're already given a rubella vaccine. But there's a thing that everyone that already had taken rubella vaccine doesn't build immunity to rubella. So just to be safe, you can test the mom for rubella. If she's immune, perfect. If she's not immune, don't give her the vaccine while she's pregnant. After delivery, you can give her a vaccine for rubella, she and the kid. Inherited or congenital, which means some moms, due to the ethnicity, are more disposed to a condition. For example, African moms are having high likelihood to suffer from sickle cell anemia or carry the genes for sickle cell anemia, and we can test that. For Jews, Tay-Sachs disease. For Caucasians, we can test for cystic fibrosis. Cystic fibrosis. Oopsie. Okay. Now let's go to prenatal routine screening throughout the pregnancy. That was the initial one, right? Now this is throughout the pregnancy. What you should be doing is anatomy ultrasound, which means, as the teacher have said before, the first trimester she should be coming at least once every month. Second trimester twice. So the more she gets closer to her to her delivery date or her due date, the more often you should be taking an ultrasound of the kid, of the fetus. Okay, so this mostly confirms the brain is developing properly, all the organs are developing properly, there's no abnormalities. And if you find maybe a high frequency or a high dot of high frequency in the heart or congenital, and then you can opt for maybe invasive or non-invasive procedures to confirm. Okay, for example, this is a an ultrasound of a fetus that has meningomyosine, which is an NTD. So this kid suffers from neural tubal defect. Neural tubal defects are they are classified into three main ones: spina bifida occulta, which is usually the spine and the meninges are are in the correct position, but you're missing a vertebrae, and you usually have a tuft of hair that gives you a sign for a person suffering from spina bifida occulta. Usually, these patients are very asymptomatic. Even there are patients that when they reach 40 years old or 30 years old and they do a normal CT scan for the abdomen or something, and then they find out that they really don't have a vertebra or they're suffering from spina bifida occulta. It's a very asymptomatic. Meningomyosine, this one is very obvious. So when the fetus is born, there's something bulging out, and it's called meningocele. Meningocele, because only the meninges is the one that is bulging out. Myelomeningocele is the spinal cord and the meninges are bulging out, and this is usually related to lack of folate. So make sure that moms are given enough folate to prevent neural tubal defects. Gestational diabetes is something very important that we should be checking. We usually check gestational diabetes in the 24th to the 28th week. How we do it is by giving the mom a 50-gram glucose test. If her blood glucose sugar is more than 140, still, we don't diagnose her gestational diabetes. We do a confirmation test, which we call her the next day fasting. Then we take her blood test while she's fasting. We give her to drink a specific amount of glucose, and then we check her blood glucose the first, second, and third hour. So now we did 3 hours of blood glucose test after the drink and the fasting glucose, right? If two out of these four tests is abnormal, we diagnose the mom having gestational diabetes, and we should treat or give drugs to control her gestational diabetes to not lead to complications. Now, pertussis, this is a vaccination usually given to the mom to prevent the kid from suffering from whooping cough. This is usually given in the third trimester and is usually part of the DTP, diphtheria, tetanus, and pertussis. Okay, pertussis should be given to the moms in the third trimester to prevent the kid from whooping cough, because even the mom, after she takes a pertussis vaccination, she can pass the immunity to the fetus before he's delivered. Let's continue. Group B strep, GBS. Group B strep is a bacteria that grows normally in the vagina. It's part of the normal vaginal flora. We should test the mom for group B strep throughout, and especially in the third trimester before delivery. If the mom is planning to have a vaginal delivery, group B strep should be screened for, and if it's positive, should be treated before delivery of the kid. Because if the fetus, why do I keep calling him kid? If the fetus passes through the vagina that is infected with a group B strep, he might suffer from meningitis and pneumonia. And it's very sad. It's something that can be easily prevented. So give antibiotics and test for group B strep. Now, NIPS, non-invasive prenatal screening test. These tests usually test for aneuploidies. As we know, the most common ones are 13, 18, 21, X and Y. 13, Patau syndrome. 18, Edward. And 21, we have the Down syndrome, as we all know. X, for example, XO, Turner syndrome. Y, we have the XXY, which is the Klinefelter syndrome. So these are NIPS. So these are tests that are non-invasive that will give you a hint that the kid will suffer from one of these aneuploidies. Let's go. The first test is called the pre-fetal DNA, which means you just take out the mom's blood, you separate the free fetal DNA, you karyotype it, and see does the kid and like is the kid will suffer from an aneuploidy? Is he having an extra X? Is he having a less Y? Is he having 21 chromosome defect? So this is usually done as early as the 10th week. That is really good. It's really early, and the sensitivity is 99%. So this can give you a hint, for example, if the kid will suffer from Down syndrome, and can even tell you the gender of the kid by the 10th week. There's another test which is part of the NIPS. They're called the 3 screening options. So there are 3 types: integrated, sequential, and contingency screening. These 3 tests are the same thing but in just different order. First of all, let's know what is the test about. The test is usually done at the 11th week to the 13th week. Its sensitivity is 96%. So this test has 2 parts. One is the blood testing part, which is you take the maternal's blood, you check for PAPA and HCG hormones in the mom's blood, and you check for the knuckle translucency. This is the fluid buildup behind the neck or behind in the back of the fetus. Okay? So the knuckle translucency test for a normal baby, it should be as less as 2.18 millimeters. If a kid has a knuckle translucency test more than 2.18 or 2.20, for example, this kid has 7.43, that means it's a sign that the kid will have an aneuploidy or suffer from an abnormality. So this is the test: PAPA, HCG, and the knuckle translucency we just talked about. So there's 3 parts. Integrated. Integrated is in the first trimester. What you do is you take the mom's PAPA and HCG, and that's it for the first trimester. You wait for the second trimester. You do a test called quad test. I'll explain it later. Quad test. So first trimester, what we did is PAPA, HCG, and knuckle. Second trimester, we just did quad. So we got a final result in the second trimester, calculating both of those results, getting a final result that will give you the probability of the kid suffering from an aneuploidy. Sequential is the same test, but what it does is, in the first trimester, it will check for PAPA, HCG, knuckle, and quad. Second trimester, PAPA, HCG, knuckle, and quad. So you get a result in the first trimester. In the second trimester, you get a result. You take an average. That is the sequential. In the integrated, we did not get a result in the first one. We just got for the PAPA, HCG, and knuckle. And then we had to wait for the quad for the second trimester, and then we got a final result in the second trimester. Sequential, we got 2 different results. In the first, we did all of them. In the second trimester, we did all of them. We took an average. Contingency is, in the first trimester, you do a PAPA, HCG, and knuckle, and quad. If the kid probability from the first trimester results is very low, you don't even do a second trimester for the contingency. So in the second trimester, they just opt for checking the alpha fetoprotein, and that's it. That is contingency. So integrated, sequential, contingency. This one is they compare. They wait for the final result in the second trimester. Sequential, the first and the second, they get 2 different results. They take an average. Contingency, they do it only for the first trimester. If it's low, they don't even check in the second trimester. Let's continue. This is the knuckle translucency test. Now the quad screening, which we have been talking about it before, right? The quad screening test is usually done at the 15th weeks to the 22nd week. Its sensitivity is a bit lower than the other 2 tests, which is 81%. This one, what it does is it checks for 4 hormones: HCG level of the mom, the estriol, inhibin A, and alpha fetoprotein. Considering these 4 hormones and the ethnicity of the mom, the age of the mom, if she's over 35, considering all of these factors, it will give you a final probability that your kid might suffer from an aneuploidy. Now, alpha fetoprotein, let's focus on alpha fetoprotein. This is very important. Alpha fetoprotein is secreted by the yolk sac, the liver, and GI system of the fetus. Now, we have a range of alpha fetoproteins, right? A range, like normal value, a range, right? Now, if alpha fetoprotein is higher than that range for a fetus in this, like when you check for the fetus, and the alpha fetoprotein is high, it gives you a sign that the fetus might suffer from neurotubal defects. If the alpha fetoprotein is lower than the normal range, it is a sign that the kid or the fetus will suffer from Down syndrome. For adults, alpha fetoprotein should be less than 10 even milligrams. So for adults, should not even be having alpha fetoprotein. If alpha fetoprotein is high in a normal adult, it's a sign for cancer. Usually hepatocellular carcinomas, Hodgkin's lymphoma, renal cell carcinoma. So it's a sign of for cancers for adults if they have high alpha fetoprotein. So it's very important for a fetus. If a fetus has a low alpha fetoprotein, Down syndrome. A high alpha fetoprotein, most likely neurotubal defect. Now we opt for invasive procedure. These are procedures, as you can know from the name, invasive, right? So some moms will opt for an invasive procedure after getting an ultrasound, maybe with a high density or high or dots in the heart of the kid. They'll opt for straight away invasive, or some of them will go for NIPS, which is non-invasive, as we have talked about here. The quad screening, the knuckle, the integrated, the pre-fetal cell DNA, right? All of these, and then if they still find a high probability, then they will go for invasive just to be sure. Invasive, there are two main ones. We have the chorionic villus sampling, which is this one, and the amniocentesis. Let's go. Amniocentesis, as from the name you can know, synthesis, which comes from paracentesis, which is just taking fluid and testing the fluid. This is usually done from the 14th to the 16th week. Amniocentesis, so they're testing the amniotic fluid. During injection with the help of an ultrasound guided, they insert the needle, take the amniotic fluid, karyotype it, and give you if they give you the probability of the kid will suffer from an aneuploidy. So amniocentesis, the risk of amniocentesis is bleeding, infection, miscarriage of the fetus, and placental rupture. Chorionic villus sampling. So we know this is a chorionic villus. So we need to sample the blood. So this is usually done with the guidance of an ultrasound. You can do a transvaginal. You go through the vagina, into the cervix, into the chorionic villus, or you can do transabdominal, through the abdominal cavity, into the chorionic villus. You take out that blood, you karyotype it, and then it will give you the probability of the kid will suffer from an aneuploidy. The good thing about chorionic villus is usually can be done very early, 9 to the 14th week. Amniocentesis is a bit done a bit late. Chorionic villus sampling, the risks are pregnancy loss. People usually before used to think amniocentesis has higher risk for miscarriage and stuff. But now it's said that both of them has equal amount of risk of bleeding or infection or having miscarriage. 9 months preparing to fall in love for a lifetime. Thank you so much for listening.